We can do this. All right, next sisters are ACE inhibitors and ARBs. ACE inhibitors and ARBs. Sisters. What do ACE inhibitors end in? Pril. What do ARBs end in? Sartan. Okay. Sisters. Now you see I drew a little kidney up there. Uh-oh, you got to watch out for the kidneys, okay? Watch for the kidneys. No, I would just say that they're pretty hard on the kidneys. Okay. So, these they only work on your kidneys and they make you pee. So you tell me what that's called. Okay. So, oh no, I lost it. Hold on. Okay. No, we're still rolling. All right. So these act like diuretics, but they're not. Okay. They don't call them that, but they literally are. These are kidney drugs. That's why there's a big kidney on it. Okay. So ACE inhibitors end in pril. We've got captopril, lisinopril, and enalapril. Okay. These are prodrugs. Do you remember what a prodrug was? That was from pharmacokinetics. No. Yeah, we talked about it a lot. Prodrug.
Is this a good drug?
No. Huh? Did you say excellent? Yeah, y'all are both twins or something. Y'all, speaking of sisters, y'all need to be on this page together. Y'all always say the same thing that's wrong. And then y'all look at each other like, yeah, you were right, girl. She's wrong. Prodrugs. They have to go to the... Nothing? All right. Do y'all have pharmacokinetics notes with you? Yeah. All right, get them out. Oh my God, get a notebook. Do you need a notebook? That's giving me so much anxiety.
Me?
Yes.
No.
Girl, your papers are just everywhere.
No, it's because I was studying this morning.
Oh.
So then right now
Do you need a 3-ring binder?
No, I have one in here.
Oh, okay.
Yeah.
Well, let me know when you use it.
Okay.
Just kidding. All right, so it's going to be on the sheet that says like absorption, distribution, blah, blah, blah. Look on the far right, I believe. Look on the far right. Uh-huh. Yeah. Oh, looky there. What's a prodrug? Oh, you were supposed to make some notes. So sugar it has nothing on it. Okay. So a prodrug is a drug that has to go to the liver to be turned on and activated before it can actually go out to the rest of the body. Okay. Now I put a star next to it, and it says not over it. What that means is lisinopril is the only one that's not a prodrug, but the rest of them are all prodrugs. Okay. The one that has a star. Mm-hmm. So if it has a star, see how it says not above it, so it's not a prodrug, but all the rest of them are. Okay. Oh, confusing. Okay. So yes.
Okay, I just want to
yes. All right, so MOA for ACE inhibitors. They inhibit ACE. Do you remember hearing ACE somewhere? Where ACE at? It's in which system?
The inhibitor?
Muscle or
no, so let me ask it in a different way. It's not a system. Which the kidney. No, sorry, let me ask it in a different way. Okay. Where have you seen ACE? What does ACE stand for? Let's start there. What does ACE stand for? No. I'm sorry. When it says ACE inhibitor, what is ACE? What does it stand for? Not ASE, not ASE, ACE. Angiotensin. Oh. Angiotensin. What does ACE stand for? Angiotensin converting enzyme. Where have you seen that before? In the RAAS system. So these drugs work on the... Where does RAAS work? On the kidneys. That's why these are like diuretics on the kidneys, but not really. You see what I mean? They won't call them that. I wish they would just call them that. Okay. So it inhibits ACE. Now, if you remember the RAAS system, if you don't remember the RAAS system, you ought to write it down somewhere. All right. So RAAS starts with an R, obviously. Where does it start? What's the R? Renin. Goes into it goes angiotensinogen, but then it goes to angiotensin 1 and then to angiotensin 2. And what's that conversion? How does it get from angiotensin 1 to angiotensin 2? I wonder where that converting enzyme is.
Oh,
ACE.
Yeah, ACE.
So angiotensin 1 only gets into angiotensin 2 by ACE. That's the middle. So it converts from 1 to 2. And where does ACE happen? In the lungs. ACE happens in the lungs. So all the rest of this is kidney. Okay. So in the RAAS system, we have renin that goes to angiotensinogen. Angiotensin 1 goes into angiotensin 2 by ACE. Then it splits off into 2. What hormone's produced over here on this side? I didn't write it down for you, so you're going to have to use your brains.
Hormones?
What hormone is produced in the RAAS system? Aldosterone. What's aldosterone's job?
To hold on to
Hold
water.
into water and salt. That's going to raise our blood pressure because the ultimate goal of RAAS is to raise your blood pressure. What's the hormone on the other side? You've got aldosterone and what other hormone increases your blood pressure? ADH. What's ADH's job? It's got 2 jobs.
Antidiuretic hormone.
What's its job?
To hold on.
Water.
Hold on to just water and it vasoconstricts. All of those are meant to increase your fluid inside, right?
Yes.
Okay, but this is an ACE
Inhibitor.
So it's stopping the conversion of 1 to 2, which means aldosterone does not come out and ADH does not come out. So instead of holding in water, you excrete it. And that's how they work like a diuretic. You see? Okay. So what do we use ACE inhibitors for? We can use it for hypertension because it gets rid of fluid. We can use it for heart failure because it gets rid of fluid. We can use it for an MI because it gets rid of fluid. We can use it for nephropathy. What's nephropathy? Something's wrong with the kidney. So this will bring fluid to the kidney. Okay. Okay. All right. Back to pharmacokinetics. Okay. Aren't you glad we did that? Yeah, it really makes a big difference. All right. So, ACE inhibitors have a first dose effect. What's a first dose effect?
So you take them
Not a first pass effect.
Oh,
a first
like when you
dose
first
effect.
Take it may not be effective.
Other way.
ineffective.
Other way. Ineffective and not effective are the same thing, right?
Where's the first dose?
It's probably on that the generic sheet, I think, or maybe not. I don't really know. I can't picture it, honestly. Did we not talk about it? It's on there somewhere. Okay. So the first dose of it. Now we talked about the first pass effect, right? The first pass effect is a drug that when you take it, it goes to the liver and it metabolizes out almost everything. A first dose effect is, you know what? I don't remember talking about it with y'all, but I know it's on your handout somewhere, so I may have just missed it somehow. But I'll tell you now. So the first dose effect, y'all might want to jot it down on pharmacokinetics too, if I didn't cover it. First dose effect means the first time you take the medicine, the first time in your whole life, and it only happens one time, that you get like massive effects from whatever that drug does. Because it's like the first time your body sees it and it's like, I've never seen that before. So for instance, let's say you're what we call opioid naive. You've never had an opioid in your life. And y'all know what opioids do, right? Okay. So how old are you? 30. So for the first time in your life, you go into the ER and I give you morphine. Your body has never seen morphine before. So you're going to be like, woo, high as a kite. Your blood pressure is going to tank because the first time your body saw it, whatever that drug does, it does it times 100. So what do ACE inhibitors do? They lower your blood pressure. So it has a first dose effect, meaning the first time you ever take it, only happens one time in your whole life. It's going to cause massive hypotension. Okay. So because I know that, I'm going to stop their diuretics a couple days before because I don't want them on diuretics plus ACE inhibitors with the first dose effect. Their blood pressure will go down to nothing. Do y'all see the difference between first dose effect and first pass effect?
Yeah.
First dose effect only happens
Once.
First pass effect happens every time you take it. Got it? Okay. One of the most tested on, I would say, in all of pharmacology is this fun fact. ACE inhibitors cause a dry cough, and you do have to report that. Now, never in my life will I call a doctor at 4 o'clock in the morning saying, no, patient has a dry cough. But where did I say that ACE happens? In the lungs. In the lungs. It can increase your bradykinin, which is an inflammatory mediator. And your dry cough will be worse, or you're more likely to have a dry cough if you are elderly, not African American, and female. Oh, why are the girls getting all the shit today? Boo. Okay, so report dry cough with prills. You say.
Report dry cough with pills.
Again,
Report dry cough with pills.
Very good. All right. You see where it says a C? That's just captopril only. Okay. So captopril can cause a rash, and captopril can cause neutropenia. What's neutropenia? Low, which are white blood cells. So it can increase your risk of infection. All of the prils, though, can cause agranulocytosis. Now, this is huge in pharm. You will see this as a side effect of a bunch of meds. What are granulocytes?
So A is without.
Mm-hmm.
And so
Cyto is cell.
granule something.
What are granulocytes?
Oh. They don't help like.
Are they white blood cells?
Yes. So it will
just
lower
white blood
all of your granulocytes, which are a type of white blood cells. And so anytime, you'll listen to me very closely, this is going to be important for this entire course. Anytime you see agranulocytosis, the answer will always be report sore throat and fever. Apparently they don't care about any other type of infection, but report sore throat and fever is huge, and you will always pick that. Okay. If the drug causes agranulocytosis, y'all should automatically, that should be like keyword sore throat fever. Okay. By the time we get to the end of pharm, and we will do like rapid fire, and it'll be like really fun, and we'll play games, and there'll be prizes and stuff like that, because y'all will know like all these drugs. And as soon as I say agranulocytosis, everybody's gonna go sore throat fever, like you're just gonna know it. Okay. Oh, I almost peed myself in it. Okay. So adverse effects of ACE inhibitors. Why would ACE inhibitors cause hyperkalemia? Because they're making you pee.
Yeah.
All right, let's follow me through. What did aldosterone do?
It
Holds in
water,
salt and water,
water.
but this is an inhibitor.
Inhibitor.
So your salt and water
Water
go
go
out. So if your salt goes low, your potassium goes high. So what drug do we not give ACE inhibitors with? We've already learned it today. And while we were in that drug, I said, don't give the ACE inhibitors. You don't know why yet, but just trust me. And now we're here. Spironolactone, because it's a potassium sparing antibiotic. You're going to cause them to go into fatal hyperkalemia. Okay. ACE inhibitors also cause arthralgias. What's arthralgias? Joint pain. No big deal, just renal failure, because these are kidney drugs. We know that. Okay. This is also very, very testable, what I'm about to tell you. African American patients should never take ACE inhibitors because they cause angioedema. What is angioedema? And that is life-threatening because we can lose an airway. No African American patient should ever be on ACE inhibitors. Do you understand? Okay. We also never use it in pregnancy. And I know I say that a lot, but this is very, very tested on. You cannot use these in pregnancy. Okay. All right. So if the patient has kidney problems, obviously we're going to reduce the dose. Watch their potassium. What happens to their potassium with ACE inhibitors? Hyperkalemia. So that means we got to watch an EKG. Daily weight, urine output. This sounds very diuretic-ish, doesn't it? Yes. Report mouth tingling and swelling. What does that mean? Angioedema. Report sore throat and fever. Agranulocytosis. Report a dry cough. That was one of the biggest things you're supposed to report, right? Yes. Do not give ACE inhibitors to African American patients. It causes angioedema. Monitor B1 and creatinine. Kidney. Can cause lithium toxicity. Now that's strange. Why? How could it cause lithium toxicity?
Because the potassium is
increased. Yeah. So that means the sodium is low, and low sodium precipitates lithium toxicity. Very good. Y'all got it now. See how fast we're moving? Do not give ACE inhibitors with NSAIDs. Why? Kidney. Oh, okay. All right. Watch for hypoglycemia in type 2 diabetic patients. Because what? What did I say? If you get hyperkalemia, what is your body going to produce? What's an antidote of hyperkalemia that your body could produce? It can't produce that. Insulin, which would then cause your patients to go hypoglycemic. You with? Okay. So under ACE inhibitors, I want y'all to write A somewhere on a post-it or something. And then another A underneath it. And then another A underneath it. And then another A underneath it. So you got 4 A's. Okay. What's the first A? Angioedema. What's the second A? Agranulocytosis. Arthralgias. The fourth? What'd y'all say so far? Agranulocytosis,
Angioedema.
arthralgias, angioedema, African American. Do not give them to African American. Okay. We got it? And that's easy because ACE inhibitors are all the A's. Okay, so that should be easier to remember. You with? All right. Their sister is ARBs. Okay, because ARBs are angiotensin 2 receptor blockers. So ACE inhibitors were inhibiting the enzyme that went from angiotensin 1 to angiotensin 2. Okay, now we're just going one step down and just blocking the angiotensin 2. So of course they're going to end up doing the exact same thing, right?
Yes.
Okay, so we're still going to use it to treat hypertension, heart failure, nephropathy, MI. Now, this is important to note if you go to the UNTB, okay? That's UTB, by the way. I just didn't want to say it on here. Okay, losartan. Oh, sorry, let me tell you what these are. Losartan, y'all got that one. Valsartan and valsartan. Okay, so losartan, they are now using in stroke prevention. They're saying if you have less fluid and we pull more fluid to the kidneys and you have less fluid that's in your brain causing a stroke. Okay. All right. So of course the side effect is going to be hypotension. These drugs were given to lower your blood pressure. And then we'll still see angioedema, renal failure, do not use in pregnancy. Now the UTMB says it's okay in the first trimester. Take that with a grain of salt. Okay. Just across the board, we're really not supposed to use these in pregnancy. Okay. Now, ARBs end in sartan. Okay. They are sometimes added with HCTZ in the same pill. So you will see on the pill bottle HCTZ / losartan. It'll have two different dosages. One for, and it'll say like, I honestly don't know what the dosages are because I don't prescribe for adults very often, but it'll say like 12.5 milligrams / 120 milligrams. So you know that that's a combo. Okay. Report mouth tingling and swelling. Angioedema, daily weight, urine output, BUN, creatinine, check BP. That's all the same as we've done for all these antihypertensives. We got it? That's easy now, right? Good, good.